Already 2 weeks before, a pigment spot of this patient was test-treated with very good results. In general, any pigment spots should be examined with a direct light microscope prior to treatment to prevent inadvertent treatment of black skin cancer. After a darkening of the pigment spot after the first treatment, for about 3 days there is only a residual reddening to be seen. The other 2 pigment spots are treated today. Apart from that, the patient will receive acne treatment for the chin region. The patient lies down on the treatment berth and is provided with eye protection. Then the treatment can be started. Each individual shot should be announced with a short caution or 1, 2, 3 for the patient to be able to get ready for it. The areas to be treated are coated with contact gel to ensure perfect contact of the treatment head. If possible, the handpiece should not be pressed onto the skin, but rather be floating on the gel surface. Areas that are not to be treated have to be covered with a cloth, for example. If the treatment is too painful for a patient, it is always possible to reduce the energy applied. On the other hand, if the patient hardly feels the pulse, the energy is gradually increased. Parameters for acne: 2 times 2.5 milliseconds, 6 to 8 joules per square centimeter. These parameters may also be used for hairy acne areas, sideburns and mustache, without the danger of a photoepilation effect, hair loss. The intruding heat of the subsequent acne treatment at the patient's chin destroys acne-causing bacteria and thus improves the typical inflammation. Thus, the lamp basically acts like an antibiotic, but without the well-known side effects. Also, the supplying vessels of the sebaceous glands are damaged and thus sebaceous production is reduced. Cold air may be used for cooling during and shortly after the treatment. In the sensitive region of the lower lip, the energy value is reduced to 6.5 joules per square centimeter. In most cases, the patients are slightly startled by the light flash. In general, the treatment is not very painful.
Letzte Mal. Gut, das war's.
In the end, the changed color is already visible as well as a slight irritation of the surroundings of the treated area. The central one of the 3 pigment spots on this side will be treated with a slightly higher energy setting next time. On the other side, the result already now is very satisfying. Soon the inflammatory acne at the chin will recede considerably.